So after a woman has a cesarean section, it's major abdominal surgery, and so clearly, muscles, nerves are severed to get the baby out. And luckily with these nerves, these are peripheral nerves, meaning they're nerves that come off of the spinal cord, and therefore they can regenerate and heal themselves, as opposed to a nerve in the central nervous system like the spinal cord or the brain that is unable to regenerate itself. But when that occurs, it takes weeks for these nerves to fully re-engage themselves and reactivate and have that communication back to the central nervous system. So after a woman has a C-section, scar tissue does form at the incision site. And what that does, scar tissue anywhere in the body will start to limit range of motion, and that scar tissue will actually inhibit motion in the joints, specifically in the facet joints of the spine where the abdominal muscles run, as well as the disc space that's in between the vertebrae can have reduced range of motion. And the discs need motion in the facet joints. The vertebrae need to be moving above and below to actually push fluid and nutrients into the disc. So when scar tissue is present, it actually reduces that movement and can cause degeneration and arthritis to occur if that range of motion is not improved on. And so it's important to stretch and work on reducing that scar tissue as much as possible. One modality that I like to use in my office is called Graston, or SASTM, which is sound-assisted soft tissue mobilization. This is an example of the tool I use in my office. And at least 2 to 3 weeks post-operative, I would take this with some cream over the incision site, over the scar after it's closed, just to help break up that scar tissue. And you can just go over the area, and if it feels or sounds crunchy, that's an indication of that scar tissue. And that's because the fibers are bunched up, and this tool allows us to break that up, induce an actual inflammation to allow the scar tissue to now be broken up and the fibers can heal flat and even and healthy.
So C-section scars, and any scar is going to be different on every person. The thing about scars that people may not know is the scar lays down not like normal tissue. It could be in just mishmash, different directions. A scar may stick out a little bit outside the body, it may thicken inside the body, and many scars may migrate away from that location. So women may come into our office and say something like, I have back pain, okay, or I have pelvic pain, or I have bladder issues. And taking their history, we find out that they have a C-section scar. All of a sudden we go look at that C-section scar. Like, why are you looking at that? Well, it has a great effect, especially let's say the woman with the back pain, she's a little bit hunched over. You start working on that scar, and all of a sudden she can open up. The woman that comes in complaining about urinary frequency and urgency, she may not realize that abdominal scar is putting some weight and pressure on her bladder. Her bladder doesn't have that expandability, doesn't have the motion. And then the woman that comes in and says, I have painful intercourse. Same thing, it may be binding down some of those organs, or the muscles are reacting to some of that scar tissue, and then they have this type of pelvic pain. So we can see somebody coming in immediately postpartum who just has the generalized pain of the scar, or around the abdomen and things like that. Or it could be a year, 6 years, 10 years, 15 years down the line. And I still, you tell me you have a C-section scar, I will always assess that scar.